Hello to everyone watching us on a number of WHO platforms. It's December 21st. My name is Tariq, and I welcome you to a regular COVID-19 press conference from WHO headquarters here in Geneva. I will just introduce you briefly to our speakers today here. We have in the room Dr. Tedros, WHO Director General, Dr. Maria Van Kerkhove, Technical Lead for COVID-19, and Dr. Bruce Aylward, Senior Advisor to the Director General. We also have online with us Dr. Soumya Swaminathan, WHO Chief Scientist. We have Mr. Derek Walton, who is our legal counsel. We also have Dr. Mike Ryan, the Executive Director of Health Emergency Program. And we have Mariangela Shimao, who is Assistant Director General for Access to Medicine. We also have a special guest that Dr. Tedros will introduce in a second. And before I give the floor to Dr. Tedros, just to remind you that we will have simultaneous interpretation in 6 UN languages plus Portuguese and Hindi. I would like to thank our interpreters who are here with us. Once we start question and answer session, you can ask question in those languages. With this, I'll give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. In the past few days, there have been reports of new variants of the COVID-19 virus in South Africa and the United Kingdom. Viruses mutate over time. That's natural and expected. The UK has reported that this new variant transmits more easily, but there is no evidence so far that it's more likely to cause severe disease or mortality. WHO is working with scientists to understand how these generic changes affect how the virus behaves. The bottom line is that we need to suppress transmission of all SARS-CoV-2 viruses as quickly as we can. The more we allow it to spread, the more opportunity it has to change. I cannot stress enough to all governments and all people how important it is to take the necessary precautions to limit transmission. This year has been difficult for all of us, but for health workers, it has never been harder. At this festive time of year, for so many, the best gift for health workers is for leaders and citizens to take precautions that ease the pressure on health systems. Safe and effective vaccines give us hope, but they're not an excuse for people to let down their guard and put themselves and their loved ones at risk. Now is the time to double down on the public health basics that have seen many countries suppress the virus effectively. There are a number of groups that continue to push a narrative that this virus only affects the old and that with vaccines on the horizon, we can relax. COVID-19 affects children and adults in a variety of ways, and it can attack every system in the body. And a growing number of people suffer with long-term consequences of the virus. This includes neurological complications for children and adults, which are still being researched. Vaccines are offering hope for some, but I'm deeply concerned that vaccine nationalism will deprive the world's poorest and most vulnerable people of these life-saving tools. Now is the time for political commitment to be translated into action. Pledges and promises will not protect anyone unless they are realized. Last week, we announced that the COVAX facility, which is backed by 190 countries and economies, has secured access to nearly 2 billion doses of promising vaccine candidates. In the early 2021, $4.6 billion in additional funding will be needed to purchase COVID-19 vaccines for at least 20% of the population of all low and lower middle-income countries. This will ensure health workers and those at highest risk of severe disease are vaccinated, which is the fastest way to stabilize health systems and economies and stimulate a truly global recovery. The 100-100 initiative of WHO, UNICEF, and the World Bank aims to support 100 countries to conduct rapid readiness assessments and develop country-specific plans within 100 days for vaccines and other COVID-19 tools. 89 countries have already completed the assessments, and our teams are working around the clock to ensure that governments and health systems are ready for global vaccine rollout. WHO has also released a new training course for health workers on COVID-19 vaccination, which is available at openwho.org. Vaccines will help to end the pandemic, but the effects of COVID-19 will continue to be felt for many years to come. The pandemic has exploited and exacerbated the vulnerabilities and inequalities of our world, but it has also shown that in the face of an unprecedented crisis, we can come together in new ways to confront it. Every crisis is an opportunity to question the way we do things and to find new ways of doing them. For 30 years, our colleagues at the United Nations Development Programme, or UNDP, have published the Human Development Report, an annual snapshot of the state of global development. UNDP has long been a critical partner to WHO, working closely on a host of health and development issues together to solve problems on the ground so that people get the services they need. The latest edition of the Human Development Report, published last week, takes an in-depth look at the COVID-19 pandemic and what it might mean for the future of development and humanity. To talk more about the report, I'm pleased to be joined by my brother, Achim Steiner, the administrator of UNDP. Achim, thank you for your partnership and thank you so much for joining us today. The floor is yours.
Thank you very much, dear Tedros. Thank you to the very kind invitation to join you for today's briefing, another very sobering and dramatic point in this pandemic. And it is an honor to be part of this press conference today to mark the launch of what you just referred to, the 2020 Human Development Report. These unprecedented times require us to come together to seek solutions to our shared problems, and that includes us as UN agencies. COVID-19 is a dramatic health crisis, and we are just being reminded of it again in the words that you have shared with us. But we also come together today because it has triggered a social and economic, a development crisis that we have not seen in our lifetimes. Not only has the virus taken the lives of more than 1.6 million people, it has destroyed livelihoods, crippled health systems, locked hundreds of millions of children out of classrooms, and is costing the world's economy more than $9 trillion over 2 years, according to the IMF, and the equivalent of up to 400 million jobs, according to our sister agency, the ILO. UNDP projects that for the first time in 30 years, global human development progress is going backwards. UNDP has calculated that by the end of the decade, 1 billion people could be living in extreme poverty. A quarter of those, 250 million, could be people pushed into poverty as a consequence of the pandemic. As the Human Development Report makes clear, COVID-19 is the latest in a string of consequences resulting from the ever-growing pressures we put on the planet in the name of progress. This is the reality of the Anthropocene, the age of humans, as we refer to it, and in it, humanity is, in a certain way, waging a war against itself. For 30 years, UNDP has released the Human Development Index, ranking countries in the world by how they expand people's freedom and opportunities, by measuring health, education, and income. But this year, we decided that we needed to try something new and long overdue. We included an experimental index to gauge human progress by accounting for per capita national carbon dioxide emissions and per capita material footprint. The result shows that no country is successful in advancing humanity without extracting a heavy toll on nature and our planet. Yes, there are countries successful in a lighter planetary imprint, and yes, there are countries with prosperous populations, but not one nation is doing both. Achieving this balance is the next frontier of human development, as the report is called. And as it sets out, very critically also, inequality is central and is a barrier to that mission. Because inequality is both a cause and a consequence of planetary imbalances, and it stands in the way of solutions. While the pandemic has undoubtedly touched us all, its impact is being felt differently depending on who you are, where you live, and how much money or power you have. Existing and growing inequalities have meant that around the world, those that already have the least have been hurt the most. And in its simplest, we have all realized that it is extremely expensive to be poor in a pandemic, whether you are a household or a country. Poor people, women, marginalized people, day laborers, and those in unstable employment or in the informal sector have all faced disproportionate hardship. For instance, evidence from a number of countries also indicates that the pandemic is erasing decades of progress in women's labor force participation. But the report is very much focused on also stating that it doesn't have to be this way. The first test of our willingness to transform will be the delivery, as Dr. Tedros just referred to, of COVID-19 vaccines to the world's population. The COVID-19 pandemic is exposing and exacerbating fragmentation and long-standing gaps in public health and deepening chronic inequities. The delivery of the COVID-19 vaccine must be equitable, otherwise we risk entrenching the very inequalities which are harming the health of people and the health of the planet and are going to give rise to more social and economic tensions. Without delivery of COVID vaccines that are equitable, efficient, and trusted, we will undermine the recovery from COVID-19 and not only lose even more lives, we have to be reminded that none of us is safe unless we are all safe. The scientists who have brought us effective COVID-19 vaccine candidates in record time have shown what is possible through collaboration and innovation. We must now be equally bold in taking the baton to deliver the vaccine to the people of all high, middle, and low income and least developing countries. This is the ultimate stress for planetary health, delivering the largest public health intervention of a lifetime and driving in a concurrent way the recovery in an inclusive and green direction. An undertaking of this magnitude, and I envy this, requires us all to work together in unprecedented ways. UNDP is privileged and continues to be committed to playing its part in the whole UN family system response, but guided in particular also by WHO's leadership while working in partnership with our sister agencies, Gavi, the Global Fund, and others through the ACT Accelerator, the SDG 3 Global Action Plan, and beyond. Thank you so much, Tedros, for inviting me to join you today, because together with the world's people, we can defeat this virus and most importantly, come out of this deep, dark valley that the world finds itself in right now. And part of that story will be a different development pathway into the future. And that's what the Human Development Report 2020 has tried to address itself to. Back to you. Thank you.
Thank you, Hakim. And I hope you will stay with us to respond to questions from journalists who have joined today. And Tariq, back to you.
Thank you very much, Dr. Tedros, and thank you, Mr. Steiner, for these very important declarations you have made. We will now open the floor to questions from journalists who are with us online. We have a big number of questions today, so let's try to be short with one question per person in the language that you prefer the most. So let's start with Shoko Koyama from Japanese NHK. Shoko?
Hello, Tariq. Can you hear me?
Yes.
Okay, thank you so much for taking my question. So regarding the mutation of the virus, which Dr. Tedros just mentioned, can you please elaborate what WHO knows so far, in which countries, apart from UK, and does the same variant has been identified, and also if there is a link between this variant and the variant identified in the South Africa? Thank you.
So thank you, Naoko, for the question. It's a very timely one today. Yes, so there has been a variant under investigation, as the UK is calling it, that has been reported from the UK. This variant is SARS-CoV-2 virus, and it has a number of mutations that was identified through genomic sequencing that is carried out across the country. The variant under investigation was reported to WHO on the 14th of December, following detailed analyses that the UK had done in the southeast of England, looking at their epidemiologic surveillance data and their laboratory data, noting an increase in transmission at the end of November, December, while interventions were in place. They did some phylogenetic analyses and they identified this variant. They're calling it the B117 lineage, which includes this mutation at the N501Y site. There's a lot of work that's ongoing in the United Kingdom, and we're very grateful for working across Public Health England, different academic institutions and modeling groups, different labs that are looking at three different things. They're looking at transmission in this variant, and if there's any differences in this virus's ability to transmit. They're looking at the disease that this variant causes, and in terms of clinical presentation and severity, and they're looking at the body's antibody response following infection with this variant. What we understand so far from the data that's been reported by the UK is that they have reported an increase in transmission in this variant, but I want to put that into context, because what they have told us is that they're looking at an increase in the reproduction number, which is the number of people that one infected individual transmits to another, of an increase of about 0.4. So it's an increase of moving from 1.1 to 1.5. So there is an increase in transmission that they're looking at. Now they're trying to determine how much of that is associated with the variant itself, as well as behavioral differences in individual that this variant has infected. So they're still working through that right now. In terms of disease, in terms of severity, the information that we have so far is that there isn't a change in the clinical presentation or severity from this variant. But again, the work is still underway, that they're looking at a number of factors, including patients who are hospitalized with this variant as opposed to the wild type, the other viruses circulating. And the studies around the antibody response are currently underway. As we speak here today, the scientists in the lab are working on these types of studies and looking at the antibody response, and we expect results from those studies in the coming days and coming weeks. So we're really grateful for colleagues working with us directly. They have informed us with more detailed analysis through our virus evolution working group, which was established to specifically look at mutations and specifically look at what are the studies that are needed to understand what these mutations mean and any potential implications. And they have informed us through our modeling network, where they've looked at trends in surveillance activities and surveillance data. So the data is coming in real time, and the UK is making information available as quickly as possible. They're reporting it to us as well, and we will make updated information available as quickly as possible. The UK has informed us that they don't believe that there's an impact on the vaccine, so that's good news. But again, there's a lot of information coming out, and there's a lot of studies that are ongoing. Point, your second point about the South Africa. So at the same time, there was another variant that was identified in South Africa, and it has one of the same mutations, this 501Y mutation, but it's a different variant. They've arisen at the same time, so it sounds like they're linked, but it's actually a separate variant. And South Africans are also working with us through our virus evolution working group, and they are presenting, they have presented to us some preliminary results from the studies that they are doing. They are currently growing the virus in South Africa so that more studies can be done, similar to the studies that I just mentioned about the UK. So it does sound confusing that they're the same virus, but these are actual different variants. I do want to say a big thank you to all over the world for people who are doing full genome sequencing and making these sequences available to other researchers and scientists and on publicly accessible platforms like GISAID. This really helps us to monitor these changes, these natural changes that happen in the virus. So we need that to continue. We are hopeful that more sequencing capacity can increase across the globe, and it has significantly increased during this pandemic, but we still need more. So thank you to all of you who are out there who are doing those sequences and sharing those through publicly available sites.
Thank you very much, Dr. Van Kerkhove. I think many of the journalists who are online wanted to ask questions precisely about this. Dr. Ryan maybe would like to add something. Dr. Ryan, please.
Yes, can you hear me, Tarek?
Very well, please.
Okay. No, I think Maria says it all, but I think it's important maybe just to re-emphasize a couple of things. There's zero evidence at this point that there's any increase in severity associated with this disease. Clearly, work is ongoing to look at transmission and the increased rates of transmission and how much of that is attributable to this particular variant. We've seen many variants emerge over the last number of months, and some have been successful, some have not been as successful as establishing themselves as part of the driving force of COVID. What no variant has done yet is establish itself as having any higher level of severity or evading our diagnostics or hiding from vaccines or the effectiveness of vaccines. And it remains to be seen with any new variant. And that's why it's so important that we continue the work. We're very grateful to the countries for their transparency, for their scientific openness and cooperation. We need to continue to do this, but it's very important. Countries are now acting on a precautionary principle. They're taking the highest amount of precaution, and therefore many countries have put in place some precautionary travel restrictions while they look at the risk assessment around this virus. That is prudent, but it's also important that everyone recognize that this happens, these variants occur. Science and health authorities and governments are looking at that very carefully. They're taking care of citizens by being extremely cautious about any new variants and examining their potential impacts. But at this stage, we don't have evidence that this virus will change the severity, the diagnostics, or the value of vaccines going forward. So I think as we enter the holiday period, as the DG said, we need to stop all SARS-CoV variants. We need to stop all SARS-CoV transmission. We know how to do this. We know how to suppress transmission. We know how to protect ourselves and how to protect others. It's the same rules with this virus, any variant of this virus. And we must focus on what we can do and what we do know rather than what we don't know. Science will find the answers for what we don't know. Governments will take the appropriate precautions. In the meantime, but people, individuals and communities need to get on with the business of stopping the transmission of this virus. Thank you.
Many thanks, Dr. Ryan. I think it was very important to answer these questions because many journalists probably would like to hear more about this. Let's see if we have follow-up on this or some other issues. Let's go to Azerbaijan, to our friend Kamran. Kamran, the floor is yours.
Do you hear me?
Yes, please go ahead.
Hello. And exactly when we yesterday get information about new mutation of coronavirus, and we want to know about the situation for South Caucasus region, for Azerbaijan. Is this danger for, how many danger for our people, Caucasus region and for Azerbaijan? Because at this time we have 4-digit number infected every day. And it's very bad situation for our health system. And what will do new version of this virus for the South Caucasus region? And exactly especially to Azerbaijan? Thank you for your attention.
So thank you for the question. I'll begin and maybe others want to come in, but I think it's worth noting that, you know, we're still learning about this variant identified in the UK as well as any changes that are happening in the virus. The SARS-CoV-2 virus in any form is a dangerous virus, and the activities that we take ourselves to minimize our own exposure are applicable for any SARS-CoV-2 virus that is circulating, including the new variant that has been identified in the UK. The measures that are in place, the public health measures that are necessary to bring transmission under control include the comprehensive approach that you've heard us talking about. And it's worth emphasizing this again, that we have to, as the Director General has said repeatedly, we need to double down because we have these tools at hand. And this includes the public health measures about active case finding, knowing where the virus is, so that we have strategic testing in our countries, so that we know where the virus is and who is infected and who is not. Making sure that test results come back quick, so that we know what public health actions need to take place in terms of making sure we have good clinical care, we have contact tracing cluster investigations, we have supported quarantine of contacts, and then all of us need to make sure that we do everything that we can to minimize our exposure. We have the holidays coming up across many, many countries, across many different religions. We need to make sure that we as individuals do what we can to minimize our exposure. We say, know your risk, lower your risk. And there are things that you can do at an individual level. And this is physical distancing, this is wearing a mask, this is washing your hands, making sure that when you do wear a mask, you have clean hands, you put your mask on appropriately, you take the mask off appropriately, you wash your hands, you practice respiratory etiquette, you avoid crowded spaces, you keep your distance, you make sure that you try to avoid enclosed, crowded spaces, especially with poor ventilation, open a window if you're indoors. So there's lots of individual level measures that you could take. And as individuals, as communities, we can all help each other out. You know, make sure that while we are physically separated, that we remain socially connected. As we come up to the end of 2020, it's a difficult period for many people, whether we have a pandemic or not. It's really important that we reach out and we help each other and we touch base with each other and just make a phone call. So everything that we can do now for this variant, as well as the SARS-CoV-2 viruses that are circulating, still remain true. We need to do everything we can to prevent as many infections as we can, because this is a dangerous virus. Not only for older individuals, as the DG also said today, it's for everyone. We are learning about the long-term effects of long COVID for individuals. There's so much that we're still learning about this particular virus. So do what you can to keep yourself safe.
Thank you very much, Dr. Van Kerkhove. Let's go to, I would assume it's Mexico. Claudia Luna Palencia from Vertigo Politico and TV Azteca. Claudia, if you can hear us, please unmute yourself. Do we have Claudia online? If not, let's go to Imogen from BBC. Imogen? Imogen, if you hear us, please unmute yourself and ask your question.
Permission comes up a bit late. Hello. I know you've said a bit about this new variant. I'm just wondering if you're able to give any more precise detail. We've heard a lot about how this is up to 70% more infectious than other strains, the strains that are already circulating. Can you give us any detail about what evidence you've seen that suggests that, and what countries should do about it, apart from what you've already said, the usual stuff we know works, wash hands and distance?
Thanks, Imogen. I will begin, and maybe others want to come in, but I am going to repeat what I just said because I think it's worth hammering in. In terms of the reports from the UK about an up to 70% increase, That information comes from different types of analyses that UK colleagues are working on. They've looked at their surveillance data across the country, looking at data that's coming in from testing at different sites in Southeast England, but also across the country, across all of the UK. They're also looking at phylogenetic analysis, looking at the sequences and doing detailed analysis of making estimates of the reproduction number, of the generation time, et cetera, to look at differences with this circulating virus and other wild type viruses. So they look at people who are sequenced, and so not all people across the UK are sequenced, so it's a subset of the population. But having said that, the 70% increase is an increase of a reproduction number of about 0.4. So it's an increase from 1.1 reproduction number to 1.5. Now this is in the presence of interventions that are in place across the UK. So what they're doing now is they're doing more analysis of this as more surveillance data and more sequence data comes in. They're always refining these estimates, so these estimates may slightly change, and that's to be expected. But what they're trying to also do is look at what is associated with this variant and what is associated with people's behavior in terms of the interventions and applying and complying with the interventions that are in place. Could be the variant, a combination of the behavioral factors, and both. And so that's what they're looking at right now. We expect more analyses and results from our colleagues in the UK over the coming days, coming weeks, as they continue to look at this. They're also doing some epidemiologic investigations of individuals with this variant compared to those without this variant. They're doing detailed studies of patients in hospitals to look at the clinical course and severity, but again, we have no indication that there's a change in disease presentation or mortality, so that's good news. And then there's the more studies of the neutralization. But again, I come back to what do we need to do? We need to do it all. The combination of factors is what works. With a reproduction number of 1.5, that means that one individual can infect more than one person. That means an epidemic will grow. But it means that we just need to work hard at making sure we don't give this virus an opportunity to do so. So especially as we see the upcoming holidays and many people wanting to spend time together, we need to think about how do we minimize our exposure, we minimize the opportunity for us to pass the virus to other ones. We want everyone to have a safe holiday this year. It may not be exactly how we anticipated spending it, but it doesn't mean that we can't celebrate it in our own way. But it's do it all. And it's the individual level measures, it's complying with national guidance, it's being patient as the vaccines and vaccination come online. We just really need to hang in tight.
Thank you, Maria. Dr. Mike Ryan.
Thanks, Imogen, and thank you, Maria. I think, as Maria said, with the work being done by the UK, and it's very responsible work, just looking at what is the combination potentially of the virus, and also just the difficulty of the measures at this time of year in any given country. What's driving transmission, and they will sort that out. But if we even look at their estimates, with the new estimate of around 1.5, that just put the bar up a little bit. In some senses, it means we have to work harder. Even if the virus has become a little bit more efficient in spreading, the virus can be stopped. The R0 is around 1.5. That means the virus can be stopped, and we've had R0s much higher than 1.5 at different points in this pandemic, and we have got it under control. So this situation is not, in that sense, out of control, but it cannot be left to its own devices, either personal behavior or the virus itself. As we learn more about the virus, we'll learn more about how it may replace other strains, and that, as I said, has happened before. But we're not talking about a reproductive number like measles, which is somewhere between 12 and 18, or mumps or chickenpox, 10 to 12. We're talking about 1.5. The virus may have become slightly more efficient in transmission. That can have a big impact on numbers when we have so many people being infected. But it means the virus can be contained, the virus can be suppressed, and it is exactly the same interventions, exactly the same behaviors, done with more intensity and more completeness, that we need to focus on right now.
Thank you very much, Dr. Ryan. We see there is a huge interest in this particular issue, and it is important to answer. Let's see what the next question will be, and it's Christian Ulrich from German news agency DPA. Christian.
Thank you very much for taking my question. Can you explain, Maria, maybe, or Mike, can you explain what more transmissible means in layman's terms? Does that mean the virus flies over more than 1.5 meters, or does it mean that there's more virus in a person, so the person standing next to that person is infected in 5 minutes rather than 10 minutes before? Just try and make it more understandable for layman's people who wonder what is different now than from what was different, what was happening 3 weeks ago. And there was also a question that hasn't been answered. How many countries have actually reported cases of this new variant so far? Thank you.
So thank you for this question. It's a great question, and I actually really very much appreciate the way that you ask it, because we sometimes forget how complicated a lot of this is, and we use a lot of terms that may just not translate very well to everybody. And so what we mean when it transmits more. So